Welcome to this mini lecture on traditional Chinese medicine and acupuncture for dry eye disease. In this session, we will move beyond symptomatic relief and explore the biological mechanisms, clinical phenotypes, and evidence-based research behind integrative treatment for dry eye disease. This lecture is designed for physicians, acupuncturists, and healthcare professionals interested in integrative medicine and ocular health. Dry eye disease is no longer a minor irritation. It has become a global health burden. Epidemiological studies suggest that dry eye affects between 5 to 50% of the population, with an even higher prevalence among older adults. Conventional treatments, such as artificial tears, often provide temporary relief. However, they frequently fail to address the underlying systemic dysfunction and chronic inflammation. This is where traditional Chinese medicine offers a unique integrative perspective. In traditional Chinese medicine, dry eye disease is understood as a disorder of body fluid metabolism, known as Jinye. Tears, considered a specialized form of body fluids, and their production depends on the coordinated function of multiple organ systems. The liver stores blood and nourishes the eyes. The spleen transforms nutrients into fluids. The lung distributes these fluids, and the kidney provides the essential essence that supports ocular health. When this system becomes imbalanced, tear production declines and dry eye symptoms develop. A key concept in TCM is the connection between essence, blood, and ocular health. When liver and kidney yin become deficient, the eyes lose nourishment. This results in chronic dryness, blurred vision, and visual fatigue. Modern factors also contribute to this imbalance. Prolonged screen use, known as visual display terminal syndrome, represents a form of overuse injury. Long-term visual focus consumes liver blood and depletes ocular fluids. This leads to worsening dry eye symptoms over time. Clinically, dry eye patients can be categorized into several common TCM patterns. The most common is liver-kidney insufficiency, often seen in older adults and postmenopausal patients. Lung insufficiency may occur in dry environments or after respiratory illness. Spleen stomach weakness can lead to poor fluid generation and intermittent dryness. Liver wind heat may appear in acute inflammatory or allergic conditions. This differentiation guides individualized treatment strategies. Dry eye disease increases significantly with age. Lacrimal gland function declines, and meibomian gland dysfunction becomes more common. Hormonal changes, particularly in postmenopausal women, further increase risk. From a TCM perspective, aging reflects gradual depletion of essence and blood. Therefore, treatment focuses on tonifying the root rather than only treating local symptoms. Treatment typically includes both internal and external therapies. Internally, classical formulas such as qiju dihuangwan are commonly used to nourish liver and kidney yin and support tear production, particularly in age-related dry eye. In patients with more pronounced deficiency, formulas such as 助景丸 or modified 六味地黄丸may be considered, depending on individual syndrome differentiation. These herbal treatments aim to restore systemic fluid production rather than simply lubricating the eye surface. Externally, herbal steam therapy or warm compresses may improve meibomian gland function, enhance local circulation, and promote tear film stability. This integrative approach allows both systemic and local mechanisms to work together. Acupuncture plays a central role in the integrative treatment of dry eye disease. We typically combine the local and distal points. Local points, as you can see in the slide, such as Jingming, Canzhu, Taiyang, and Sizhukong, improve periorbital circulation and stimulate lacrimal gland activity. Distal points, such as Taichung, Sainjiao, and Taixi, can regulate liver and kidney function and support systemic fluid production. In clinical practice, the combination of local and distal points creates a root and branch treatment strategy. Patients often experience both immediate symptom relief and gradual long-term improvement. Treatment is typically performed 1 to 2 times per week, with noticeable improvement after several sessions. In some cases, electroacupuncture may further enhance tear secretion and anti-inflammatory effects. Acupuncture also works through neuroendocrine mechanisms. Stimulation of periorbital acupuncture points activates the trigeminal nerve reflex arc. This enhances parasympathetic signaling to the lacrimal glands. As a result, tear secretion increases and ocular surface hydration improves. Beyond neuroendocrine regulation, acupuncture also reduces inflammation. Studies show decreased level of key pro-inflammatory cytokines, including interleukin-1 beta, tumor necrosis factor alpha, and interleukin-6. Reducing inflammation improves tear film stability and promotes corneal epithelial repair. Clinically, these effects translate into measurable improvements, including longer tear breakup time and improved Schirmer test scores. These findings support the anti-inflammatory mechanism of acupuncture in dry eye disease. Clinical studies support these mechanisms. Meta-analysis demonstrate improved tear secretion and symptom scores with acupuncture. Randomized controlled trials show longer-lasting symptom relief compared with artificial tears. These findings suggest acupuncture provides sustainable benefits rather than temporary lubrication. In conclusion, dry eye disease is a multifactorial condition involving fluid deficiency, inflammation, and neuroendocrine imbalance. Traditional Chinese medicine and acupuncture address these mechanisms at multiple levels. By restoring systemic balance, we move beyond symptom management toward long-term ocular health. Thank you for joining this mini lecture. For reference and further reading, please see the description below.